Welcome, friends, to another episode of Fitness Tips for 55 Plus. My name is Dr. Jeff Musgrave, Doctor of Physical Therapy, and today we have a very special guest. I think you're going to learn a lot today about things you can do to improve your brain health. So if you wouldn't mind to introduce yourself.
Yes, my name is François Pomerleau. I'm a scientist, work at the UK. I study aging and some related disease to aging, Parkinson's, Alzheimer's, frontal temporal dementia, or other dementias associated with the brain. And I've been here at UK for 24 years now.
Okay.
So 2000, yeah, 24 years.
So you're telling me this isn't your first year as a researcher?
No, it's not. And although in 24 years we have made some progress, there's still a lot to do.
Yeah,
so, yes.
Excellent. So kind of how all this came about is I was coaching class last week, and we got to talk about work and about the type of training that we do here. And I said, lo and behold, we have an expert in the field taking classes with us, actively doing research on things that we want to see people improve, which is their brain health, and to help stave off any changes possible to their cognition, to their memory. So I'd love to just hear a little bit about maybe some things that, I don't know, common misconceptions of things that are helpful or things that maybe people have heard that haven't panned out in the literature.
I guess one of the biggest misconceptions, if you can call it that, is there was a time when those brain teasers, on Facebook or were like, you have to do this to make your brain better, blah, blah. It does help to make your brain better for this particular task, but it does not
translate
to other areas of the brain.
Okay.
So that's, for me, that was one of the biggest things that I tried to tell people. Yes, you can do the, crossword puzzles, all that. That's fine. You can do it, but it doesn't like supercharge your brain in any way possible. And I always try to tell them that if you do that, you always have to do it in combination with exercise.
Yeah. Okay.
So everything comes down, as I told you, to exercise.
Yeah.
For keeping your brain healthy.
Yeah.
So
it sounds like
so if you do the brain teasers, that's fine. Just add exercise to it, as you shown me last week, which was pretty interesting. But that was one of the biggest one. I can't think of another one right now.
Okay. Any supplements or things?
Yeah, of course, nutrition is always important.
What things are helpful, maybe from the nutrition side?
Just have a balanced diet. There's no secret to it. People always tell you, this has antioxidants in it. This has no antioxidants. Just antioxidants are important, but there's a limit in terms of what your body can absorb.
Yeah.
Okay.
So you can't just eat blueberries all day and reverse changes to your brain.
One of the famous scientists who was really into antioxidant, unfortunately died young.
So maybe it wasn't the poster child for that thought.
Yes, it's a anecdote. It's not because he was eating too many antioxidant, but it's just that a lot of diets are fad. Just take the Atkins diet. He died young. So Mr. Atkins was not, even though he was slim and healthy, he just died young. So it doesn't mean that because you're doing something that is a fad and it works, that it's actually good for you. So
or long term.
Yeah. So I always tell people, a balanced diet. It's not complicated. Of course, greens, yes, vegetables and fruits that are darker are better, but it has a limit in terms of what it can do for your brain or your body.
Yeah.
So
it sounds like still need to eat some carbs,
yes,
some fat, some protein in a reasonable proportion.
Correct.
And maybe trailing off into extremes, maybe not so helpful.
Exactly. And alcohol has some benefits. So, but if you exaggerate, it's the same thing. Exaggeration is always it's always a problem.
Yeah.
So
Okay.
in anything. So, but anything you can do to have a balanced diet is what you need to do.
Okay. So antioxidants may be helpful to some degree,
Yeah,
but going
yeah.
overboard on that's not going to be helpful, just like
Yeah.
any other nutritional path that just takes you into an extreme, maybe not the best thing for your brain
Exactly.
or your longevity.
Vitamins is the same thing. Taking pills will not replace actual food.
Okay.
That has been shown. I guess you probably know about it many times. That taking vitamins is usually will eliminate it more than you actually absorb it.
Yeah,
So,
we'll jokingly say it's expensive pee.
Yes.
It's expensive urine.
Yes.
Your best,
So,
the best is if you can get it from natural sources.
Yes. Yeah.
The way the mode that your body was designed to break it down and absorb it.
Correct.
So, I mean, that makes sense.
Yeah.
So if you've stacked up a bunch of vitamins just for your brain health, you're only eating blueberries, maybe rein that back in, a little more balanced diet. Try to find those things through variety of nutrition.
You need your protein, your carbs, and your fat. So.
Yeah, all of those things in proportion.
And the older, of course, age dependent too. So you gotta think about your age. So I'm getting older. I need more protein.
Yes.
So I'm losing mass. I'm losing weight, but I'm losing muscle mass, which I'm trying to reverse by coming here.
Yeah, absolutely.
So.
And that's something we talked about. We were talking about that age-related loss in a prior episode about sarcopenia, which is the term.
Yes.
But yeah, I mean, that's a lot of the literature that we've seen is shown that over time you actually are less efficient in absorbing protein as time goes on.
And making muscle.
Yep. So you have to push a lot harder and lift heavier, which is usually the opposite of what people hear. Is like, oh, you're getting older, you should take it easy.
Yes.
It's like, oh, I'm not as hungry, I probably don't need to eat as much as I used to. And it's like, well, actually you need more protein and you have to continue to push that intensity. And I think that segues really nicely into some of what we were talking about on the exercise piece. So it's kind of cool, you being a researcher in the area, you found your way to our gym.
Yes.
So I'd be curious,
I'm finally, after preaching a lot, I'm finally decided to, it's like, okay, I got to do, on my own, I just wasn't motivated to go to the gym. And I haven't also updated the way I train at the gym since my, years when I was maybe younger and playing football and really pushing. So, and I think I needed something to get me going, and so since I have to make sure I come here and do the training, it's different than having to go on your own, train, and and also I always hated cardio, so I never included cardio in my training, or rarely. So that was not the best way to train. So
always had stiff shoulders, so I never wanted to lift overhead. But I found myself on that journey where I'd been an athlete for a long time. I could lace up my shoes, I could go work out on my own, and there just came a day where it's like, I don't want to do this on my own anymore.
Exactly.
And I found group fitness, and it was helpful for me, just having someone say, you going to be here tomorrow? Or where you been when you've been gone for a while? And you signed up with friends.
Yes.
So they come. So a lot of times you get to come.
They convinced me. So because I heard from from them. So, and the more he talked about it, the more it was interesting. So, So I decided to come, and I'm staying.
Yeah, I love it. So on the research side of things, and we may have been looking at, I don't know if we've been looking entirely at the same body of literature on the aging brain and longevity, but the research that we've primarily built a lot of Stronger Life training on is high intensity interval training, where it's like there are bouts of intense exercise followed by complete or near rest, so that we can push intensity. What have you found in your research?
Really, the NIH has multiple publications on training and health in general, also brain health. Basically, if you increase blood circulation to your brain, you clear out the bad and
waste products.
Waste products, and you try to nourish the cells that help your brain stay healthy. So, in animals, it's easier to see what exercise does to the brain because you can actually measure things directly in the brain. In humans, the results of exercise are harder to determine. But they can say that trophic factors increase. So trophic factors are important for your brain growth.
Okay.
And so they can measure 2 or 3 trophic factors. There's multiple trophic factors, but in the blood, there's not as many as. If they could directly measure in the brain, it would be easier. MRI shows that the blood flow is really important for keeping cells healthy. So there's more literature than I expected when I took a peek before coming here.
Perused a little bit.
Yes. So it's really interesting how it helps. So
yeah, and I mean,
of course, the increased exercise will affect a very important aspect of your brain, which is inflammation. Okay, so inflammation is bad.
Yeah.
If you increase blood flow, you decrease inflammation, and you have a stronger brain.
Yeah.
So
that's great, and that some of the literature that we've looked at has looked at across multiple studies, like not all included in the same study, but low intensity versus moderate, or moderate compared to high intensity, and of course, a lot of people saw those interventions, even though they were superior, they were afraid to do them with like populations that had neurological conditions.
Yes.
That it was like, maybe not safe to do that. But can you speak to that at all?
I just read, it's the opposite. So for let's say for Parkinson's patients, you have to try to get their medication proper so that they can actually move and exercise. So of course, initially, all Parkinson patient gets levodopa to increase the dopamine in the brain, be able to move, and if they get that in track, they highly recommend them to exercise while they're on
the
proper
medication.
medication. Yeah, even on medication, try to move as much as possible.
Yeah.
So it's going to help, muscle strength, but also diminish inflammation and help the cells not go away. So,
that's exciting, and I think a lot of people, depending on when they learned about these conditions, maybe aren't aware that like there are things you can do.
Yes.
And I think that's the worst thing is when people don't have hope. They get this diagnosis and they think there's nothing you can do, or there's no change.
Depression is a big part of when you get Parkinson's. A lot of people have depression at the same time, so it's hard to get moving during that. So getting stimulated to be able to go and do that, can come from a place like yours. And, I don't know if you could have just a class of Parkinson's patient.
If we had enough, people that were interested, that could definitely be an offering. We definitely have multiple people here that take Stronger Life classes.
Yeah, because I would think that I don't know if they would be not scared to be in a regular class. You know what I mean?
Yeah.
It's always the same when you have a disease. You always feel different. So you feel you can't be with other people.
Yeah.
So, I don't know. That's
so far they're integrated into the community.
Yeah. If they integrate, that's great.
Yeah.
So,
very good. So it sounds like high intensity interval training, aerobic training is important.
Yeah.
How about strength training?
Always. As I said,
aging brain, but aging body. I know you study longevity.
Yeah. So you want to try to keep your muscles going, otherwise you're going to stop moving. So,
yeah. Absolutely. Yeah. So strength training, aerobic training, a balanced diet.
Yeah.
Team, if you were looking for some sexy magic bullet from the expert, would you say there's one special thing, or is it diet and exercise, truly?
It's really diet and exercise. There's no, right now, especially for Alzheimer, there's no drugs that helps. A little bit of Risolol, but that data is iffy. I don't know. I'm not convinced yet.
Yeah.
But for Alzheimer, there's actually nothing. They're trying to
from
remove
a medication
the plaques.
standpoint. Yeah.
So they're trying to remove the amyloprotein plaques with antibody. It seems to work, but I don't know if it does anything for the disease. It removes the plaques, but we don't know if it does actually help the disease. So we're at the point where we're studying that. Actually, at UK, Dr. Jaika is really involved in a new type of antibody that seems to work really specifically for removing plaque.
Wow.
It has secondary effects that are not good, but if it can actually help the cognition, that would be a big
if you can
big
change
step.
that trajectory.
So for Parkinson's, there's different drugs, of course, that helps, but it still doesn't slow down. In our lab, we have a clinical study right now that, as I didn't mention to you, anyway, where we're trying to at least stop the progression of the disease. The patients that come in and have deep brain surgery, a DBS probe, and into the brain.
Deep brain stimulator.
We also implant at the same time a part of the sural nerve, which is a nerve in your leg. So that we actually take it out, stimulate it, so the trophic factor gets stimulated. We implant it at the same time as a DBS probe, and it seems to help prevent the cells from dying. So we had a patient after 10 years who he was one of the first patients. He donated his brain after he passed away, and when we studied that brain, the sural nerve that was implanted was still alive.
Wow, that's really exciting.
So it is a good step. I know it's invasive. I understand a lot of people are afraid of something that invasive, but if it helps, at least it doesn't cure the disease. You don't go back to yourself, but at least if you can stop the progression, that's I think it's a big step. So in any disease, if you can stop the progression, then you're good. We don't have that in Alzheimer yet. But in Parkinson's, if we can show that works right now, that would be. It'd
be very exciting.
Because if it's invasive,
it's invasive, but if you can catch it early, stop the progression.
That would be something to do.
Very impressive. So I want to circle back about dementia just a little bit. So I've heard it termed as like type 3 diabetes, and there being a strong metabolic component. Can you speak to that? I'm curious your perspective, having been researching in the area.
It's, I guess since Alzheimer's or dementia is idiopathic, most of the time you don't know why. You try to find, a reason. So yes, metabolomics is probably involved. I mean, their metabolism is definitely involved. We know that mitochondria are affected in Alzheimer patients. So
those are the powerhouse of the muscles.
Yes, the muscles and the brain. I mean, and any cell, mitochondria. So we know they're affected. So metabolism, yes, is important. Do we want to call it a diabetes type 3?
Maybe a stretch.
I was like,
but just a common thread of like the metabolic piece. Like there's some correlation to metabolic health, but not like. I want to be
just
careful
trying to
here.
Put labels on something that already has a label, which is dementia. I mean, it's there, and as I said, it's idiopathic, so we don't know what causes it unless you have a genetic link. So, it's interesting how scientists try to label everything. So
and maybe it's for us that can't reach to the top shelf, cognitively ourselves. We need, maybe it's to reach for simpler terms to explain things, but
tend to oversimplify things.
Okay, that's fair.
Another pet peeve of mine is media trying to oversimplify things. So you do a discovery.
It makes a better story, right?
Yeah, it does. You make a discovery, and then you're like, oh yeah, it's like, no.
And then there's a big product push, right?
So you got to be careful of the media. So always try to rely on an expert, which is not easy. So some people label themselves as experts. Label me as an expert. I study it. I know probably more than most people, but
I'd say 24 years of research. You could fairly say you know more than most.
So it's always, experts are always sometimes a danger. So you got to be careful what they say, and what they try to push.
Humans come with opinions, right?
Yes. So,
Yeah.
So what as I try to explain to people, it's not complicated. It's exercise, diet, and try to lower your stress.
Yeah, and that's exactly what I was getting ready to ask you for. If someone was worried about their brain health, the longevity, function of their brain, or maybe they have a condition like Parkinson's disease, you kind of talked about that specifically, but if we were to, it's not fair to do, but if we were to put that into just one big bucket of brain health, the 3 things that you would recommend.
The first thing is exercise. That's, as I said, I haven't done what I'm preaching, but
you are though.
Right now, I am. Exercise, good diet. I overindulge in sweets a lot. I'm trying to, balance that out. And I'm getting older, so I feel it. When I don't eat right, I know.
Yeah.
There was when you're young, you eat anything, and then stress, inflammation. So
exercise, balanced diet, and then controlling stress.
Yeah. So controlling stress. I do transcendental meditation. So that helps.
Do you use any type of app for that, or
no?
were you
I just
taught a
took
strategy?
The class. There's a transcendental meditation place in Lexington. Yeah. So you go there, they teach you how to do it properly, and
that's beautiful.
So a lot of people use mindfulness too. So there's an app for that.
I've seen the Calm app or some of those.
The TM people say mindfulness is not good. Mindfulness people say TM is not as good. If you look at the studies, TM seems to be a little better.
Okay. So transcendental meditation.
But mindfulness, I think, still works as long as you lower your stress. Do Tai Chi, yoga. There's different ways to. Even exercise, release endorphins.
Yes,
so.
And I was going to mention that. I didn't want to dig into it too much, but on the depression side of things, it's hard to start.
It is.
Especially if you're in a depressive episode. But if you can do something, the literature that I've looked at shows that can be helpful. Maybe you don't hit it as hard. Maybe you're not your best self at the gym, and that's something we try to encourage in here. Find a community. There's not stronger lives everywhere at this point, but we want people to exercise. But find a community where it's okay to just show up how you are. And especially if you're depressed, it's harder to get there. Don't put a bunch of expectations on yourself. Just show up and do something. Something is going to be better than nothing, for sure.
I agree. I mean, expectation is always a difficult thing to... You expect something and you don't get it, you get depressed.
Absolutely. That can make it worse.
Yes.
You'll get the physiological impact.
You got to go expectation versus what you can do, and and just go from there. And so
beautiful.
Yeah.
I want to thank you so much for your time joining us. Thanks for adding so much value to this conversation. There's a lot of noise out there on nutrition and supplements. It's good to know that for just your general health, we should already be eating a balanced diet, more protein the older you get, making sure you're hitting those protein numbers, aerobic training, strength training, and managing stress.
Yes.
Those 3 things are just as relevant for brain health as they are the rest of your body. So that's actually really encouraging news.
It is.
You don't have a whole new list of things to do. You just have to find a way that works for you to get those things in. Well, we always finish this with a high five. So
hey, good talking to you.
Thank you.